Dr. Shani Fox, very interesting woman. She gets cancer survivors to get their life back. Noble, noble endeavor. You know, we've all been touched by cancer. Once they're going through all the treatment and what happens, and then they survive. What happens next? They applaud there at the institution, at the cancer hospital. They ring the bell, congratulations, and then they're kind of let free. And many of them face issues with empowerment, with identity, with it's fascinating that just in the recent years, this kind of service that Dr. Shani Fox offers is becoming more prevalent, becoming more required, because the cancer patient survivor has never asked for this. It came upon them. Very interesting discussion. I really enjoyed talking to the doctor. Her take on discipline, very interesting. Just, spoiler, I want to tease it a bit, but she talks about will and commitment, not only for her, but her patients. But excellent discussion. I know you're going to like it. Thanks for listening. Hi, I'm Joey Pinz. People ask me, how did I lose 130 pounds? The quick answer is always discipline. I started my business, wasn't paying attention to my health, was eating too much, drinking too much sweets. My daughter was born. Next thing I know, I'm pre-diabetic. I have hypertension. I knew something had to change. Discipline. I, like many of you, have faced many challenges in your career, in your family, in your life, in your faith. How did you attack them? How did you approach them? How did you solve them, hopefully? It all had to have some degree of discipline. I'm also asked, how did you found and start a tech business and it lasted over 25 years? Discipline. I was committed to it, enjoyed technology, didn't enjoy some aspects of it, but knew it was necessary. Discipline. Our podcast mission, how do we use discipline to better ourselves and society? Join me, please, as I talk to interesting people and discuss how they use discipline in their family and their passion and their careers and how it helped them. Our podcast vision, growth through learning from others. Joey Pinz Discipline Conversations. It'll be light and serious. Join us, please. Thank you for consideration. Thanks for your time today, Dr. Shani Fox.
Shani. It's Shani Fox.
Shani.
Yes.
Yeah. You're in the great Northwest in the Portland area.
That's right. Yes.
Yeah, very nice. You're can your services, can what you do, to help cancer survivors get their life back, can that be moved to any other kind of trauma? Why is it cancer specific?
It's cancer specific simply because I chose to focus there. The need was great, and so I developed methodology that works in that arena and a great understanding of the particular issues that affect cancer patients and survivors. Many of the principles could move to other areas. I'm often asked, for example, if I support the families of the survivors as well, or the patients, and the answer is yes, and I'm able to use a lot of the same work that I do to focus on them as well. So that's just one example, but it could apply in other areas as well.
And why is there I fortunately, I haven't had very close family members, but why is there a disconnect in the medical system? It would seem that this kind of service should be offered as part of the process. I'm finding out that it's not.
Yeah, what I have observed and what many, many people who have been through this experience have observed is that the medical system, the conventional medical system, God bless them, they do so many good things, but they're so focused on the medical treatment of cancer, which takes a lot of focus, that there has been, up until very recently, simply a lack of awareness as to what comes after that. There's this such a focus on the treatment that when treatment is done, people are basically, what happens is there's usually a little celebration. They ring a bell. There's all kinds of ways to celebrate this. It's cute. But in that moment, everybody on the staff says goodbye, and the patient is left kind of, it's like, what do you mean goodbye? You've been supporting me for months now.
Right.
And now all of a sudden I have nobody. And they are not the person they were when they started this journey, not only medically, but even emotionally, especially emotionally,
Hmm.
perhaps. And so there are all kinds of issues that present themselves at that point that were not until very recently recognized at all, pretty much by the medical system, much less supported. In fact, there was a lot of denial about it in the sense that people would want to come back and see their oncologist, not just when they needed a scan, which is necessary, but when they had questions. And the team simply wasn't available until recently. There's just a very new budding awareness, essentially, that this is a whole stage in and of itself and needs support.
That's fascinating to me. It would seem a good friend of mine's son had leukemia, and he was able to fight it off, and we were there supporting him and everything. But it was like, once he beat it, I wondered, because there was so much focus. It was at Sloan here in the Northeast, and there was so much focus on him that after it happened, I almost kind of it was almost kind of a it seemed like kind of a shut off at that point. I said, what happens now? Is there any kind of service? Does he continue to discuss it? Is he
Mhm.
just does he beat it and it's over with? Now get on with the life. It's just it seemed uh, a bridge was just necessary.
Well, that's great awareness on your part, because yes, a bridge is necessary.
Mm,
And again, that hasn't been recognized until recently. The question you just asked in there, what happens now?
right.
This is the question that cancer patients and survivors are asking. What happens now? If I'm not the same person I was, there's a lot of confusion. I'm overwhelmed. I may not even be feeling very well still as a result of the treatments. What do I do now? And I certainly don't want that to happen again if I can help it. So, what do I do? What do I do? Who can help me?
It's so fascinating because if you're seeing somebody for a trauma that happened, then it's over and it happened,
Mhm.
and or whereas cancer, you're currently living in it. I can't think of something else. I mean, if you're sick, I mean, dementia, certainly these are things that can't be beat, unfortunately, this
Mhm.
time, but cancer, you're actually living in it for a while, then hopefully you beat it and then you need to move on. Where it seems that others, you're not in it at the moment dealing with it. I don't know if there's any analogy to that.
Well, you're right. There's a difference. I mean, for example, there are acts of nature which cause trauma to human beings.
Mm,
Big earthquakes or fires or things happen. But you're right. They are expected to be one-time events.
right.
And yes, there's certainly recovery and support needed, but we don't expect that they're going to come back.
Mm,
Whereas cancer, I mean, we're getting some cancers are beatable these days, which is wonderful, but there are many which are beatable for a while. But even after, 5 years is often the survival mark, this great survival milestone, which it is, but people will find that, 10, 15, 20 years later, all of a sudden it will come back.
hmm.
So they always have in the back of their mind, survivors always have in their back of their mind, this could come back, this could come back. And in certain percentage of cases, it does. So that engenders a certain ongoing fear
Hmm.
which I suspect is different from, let's say, the example I just used, that let's say somebody lost everything in a fire, which is very tragic, of course, but we don't expect that that's going to recur. We don't live with the fear that's going to recur. We just have to simply
Right.
pick up our bootstraps and move forward from where we were.
Fascinating. So when that handoff happens now, right? They've beat the cancer, and that's terrific. And then they come see you. How do you begin talking to them? How does that work? I mean, that's incredible burden on yourself, right?
Well, it's quite a wonderful process, actually. It's the
Mm,
perfect example of meeting somebody where they're at.
hmm,
So the first thing I do is simply talk to them a bit and find out what they're struggling with. How's this showing up? Is it more of a physical struggle? Is it more of an emotional struggle? What is it like for them? How is it affecting their life? So I just need to get a picture of where they are. Looks very different. There are certain common themes among survivors as to what may be going on. But for any individual, it's a very specific process tailored to them because they're all in different places. I have people who come to me right after treatment when they're first encountering these questions that we're talking about, and I've had people come to me, for example, like 9 years after treatment and still say, "I'm floundering. I've been floundering ever since."
hmm.
So it's very different for the individual and what they've done so far. So I have to meet them there and pick it up from that point on,
Wow. And
depending on
you've
what I
got this
discover. Yeah.
you've got this terrific kind of quiz or kind of survey on your website where and it's a great little introductory video. That's a great idea.
Well, that helps people see for themselves where they're at.
Mm.
Some people are ready to talk to another person, to a professional, and some people are not yet. But that gives them a chance to look at some of the potential issues that could come up and see where they stand. As they may have no problems with certain things, but then other things are very significant and severe for them. So they get a chance to rate themselves a little bit and figure out where the focus needs to be.
Hmm. And do you meet with them in a group or one-on-one or virtual? Or
It's been virtual for some time, even before
Mm.
COVID. Because this work lends itself to virtual work, I gave up my office in 2018 and went all virtual. As it turned out, that was very fortuitous for a number of reasons.
Mm.
One of which is because I'm not limited to my geographical area anymore. I can work with anybody across the country or in Canada and have. So it's lovely that virtual setup allows me to meet people in a much greater geographical range, allows for a lot of flexibility as to when we meet, et cetera. So it really is great a setup, that the fact that it's been virtual for some time.
Hmm. And so you mentioned that some of the side effects that what are the side effects, and it's not what you think. Can you elaborate on that or the cancer side effects, the common?
Well, a question I often put out there is, what is the most common side effect of cancer?
Mm.
Any idea?
If I were to guess, it would just be uncertainty.
It is uncertainty, which leads to fear, and that's what I call the actual side effect. It's
Oh.
documented. Research has, for some time now, documented that a good 70%, so the overwhelming majority of cancer survivors, struggle with fear on a constant or intermittent basis,
Hmm.
of the kind that we're talking about, this fear of recurrence in particular, but also fear of living their lives in a lot of cases, because this thing is holding, they're holding this thing over their head.
My goodness. And you kind of came from a parent had pancreatic cancer, as I understand. I mean, that's a very tough. That's one of the really bad cancers.
It is. It's often discovered very late. It's often in very late stage when it's discovered, most of the time, in fact. And so, yeah, a diagnosis of pancreatic cancer. This was my father. Yes, it was 3 months exactly from the time he was diagnosed to the point that he passed.
Wow.
Um, so yeah, that's a very short and hard journey in that particular case. That was really my first very upfront and personal experience with cancer.
Hmm. And that led you to this road.
Eventually, yes, not immediately, but when I discovered, this is before I was a doctor, by the way. I hadn't even gone
Hmm.
to medical school at that point. But um, what I discovered through the journey with my father was that I was the person who could hold this experience, as hard as that was, but I could hold this without being in denial about it.
Hmm.
Everybody around, including the rest of my family, kind of wanted him to go do chemotherapy and go do this and go do that in order to fight it.
Hmm.
Um, and I never said this to my father or any of them, but knowing what the impact of this diagnosis was and that his time was likely short, I was actually holding myself the intention that he perhaps not do chemotherapy, because first of all, the chemotherapy does not have a high success rate
Hmm.
at that stage. So the chances were minimal that they would help. And it would destroy his quality of life in this particular case. I'm not recommending that to anybody else, but in that particular case, I was holding that he would not do it. He did not do it in the end. And therefore, for the first half of the 3 months that he had, he was living still well. He was tired, but other than that, he was seeing friends, seeing people, doing the things that were important to him. And only then did the fatigue and everything else set in, that he declined, and then that was the end of the journey. But he was able to live the best he could during those 12 weeks because he did not, in his case, go into treatment.
Wow. And so you go to medical school
Mhm.
and then you decide to do this. So it's still there's still you're you're killing the main story here. What did they say? I mean, why go into this area?
Ah, Well, I went to
Stepping
medical
stone.
school being interested in a broad spectrum of areas. I
Mm.
went to naturopathic medical school. We're holistic doctors, and so we are interested in the entire person, mind, body, and everything else. It's
Mm.
all one package. And I went in with a great interest in that. About halfway through medical school, there was a presentation. A doctor from the field came in with three cancer patients, and there was a panel discussion there about their experience, and I was very, very moved by that experience, to
Mm.
tears, really. And that didn't happen every day in medical school. So I remember thinking at the end of that presentation, well, what is this? What got to me so about this? And I remember not even going to the next class right away. I went to a stairwell and just sat in a stairwell and said, what is this? What's going on for me here? And
Wow.
realized that what had moved me so was that these people were in such a vulnerable place. They were all in active treatment at the time, some with rather serious cancers. They were in such a vulnerable place. And when people get to a vulnerable place like that, no matter the cause, they're often saying, um, I want so badly to live and to live well that I'm willing to look at anything I need to reevaluate in my life.
Hmm.
And that was true of these people. That was what was coming through in this discussion that I heard. And I realized what a wonderful place to work with people. Yes, there's certainly very significant issues, medical issues to be dealt with, but on an emotional level, they are wide open and wanting to know, how can I live the best possible life? And what do I need to do to get there? So that just redirected me as far as my medical studies. At that point, I took every opportunity that I had to observe, to assist in medical clinics that were dealing with people with cancer. I like to say I camped out pretty much for about 6 months with a conventional oncologist, following him around, watching what he does, watching how he dealt
Wow.
with people. So I just pointed all the optional parts of my training toward working with people who have or had cancer.
Amazing. And once someone is cured, what are some of the issues that they face?
Well, the fear is huge, as we've mentioned already. That's
Yeah.
something that is very common and needs to be dealt with because it's affecting a lot of the other areas of their life. So that's huge. There are also a lot of identity issues at this point. When we think about it, people lose body parts in this process often,
Mm.
whether or not it can be seen on the outside, but they are without a piece of themselves.
Hmm.
Um, a lot of things have happened on this journey emotionally. Um, People will say, I couldn't believe how beautifully certain people showed up for me. And they will also say, I couldn't believe that so and so didn't show up for me at all.
Mm.
So it can have a huge and devastating effect on relationships
Hmm.
in some cases. It can certainly, and this was true of my father, not so much from his cancer, but from an early experience in his life, it can make people very aware of the preciousness of time, of life itself,
Mm.
and realize that certain things about the life they've been living up until then don't work for them anymore, and they want to make shifts in that, but they're not sure how to do that. So beautiful possibilities here, but people struggle with it. If they don't move on that, if they don't make progress on that, that's frustrating to them. And if they do, it's challenging to the point of being like, earth shaking.
Hmm.
It can be real big changes, and that's beautiful, but it's something they need support with very often. Um, and then there's a big, big issue about reclaiming one's personal power.
Interesting.
The way I view that, or the way I've come to view that, is that an unintended side effect of the conventional cancer care system's way of handling cancer is that it can be very disempowering to people. They
Hmm.
don't mean that. They mean well, of course. And it has nothing to do with the medical care they provide, which is as wonderful as it's ever been and getting better. But what happens when a person's diagnosed with cancer is that, first of all, it's a shock. Most people do not know going into that office that they have cancer, and
Right.
some people have symptoms, many people don't. And so it's a real shock to be diagnosed with cancer in most cases. And then the very next thing that happens is that a treatment regimen is recommended, and you enter this chute where you've got a whole structure laid out for you: when to show up, who's going to be there,
Hmm.
exactly what to do, what you can eat, what you can't eat, what you can do, what you can't do. It's very, very rigid and structured. Needs to be. I'm not in any way dismissing that, but the effect that comes up is people have to give themselves over to the system.
Mm.
That has, of course, a purpose. But then when that ends, when that structure is no longer applicable at the end of treatment, they're left at total loose ends. Somebody described this to me as being led through. When you're in treatment, you're being led through a maze. Everybody's holding your hand, and you're being led through a maze that you don't know your way through, but they know the way through. So they'll help you through it. And then at the end, there's a door. They let you out into an open field with no landmarks,
Mm.
no way of knowing even where you are or which direction you're facing. And they say bye bye, and they close the door. So you're completely disoriented
Wow.
from having given over your power of decision for so long. So to me, one of the very most important things I need to do with people is assess where their sense of power is, where their sense of being in charge of their life is. And very often it's very decreased from where it used to be, and they're feeling that. And so we need to reinstate that sense of personal power, the sense that I'm in charge and I can make my own choices and handle this.
That is incredible. I never even considered that. So I would think that some would just kind of surrender to that, to that whole process and being handheld and being, instructed, and once it's over, seek it out, and then others that would, want to break free from it and kind of fight it along the way and, look forward to actually breaking it. It's very interesting. Either
Yes,
they might succumb or they might rebel, or
exactly. You're right.
somewhere in between.
Hmm.
Yeah.
That's exactly what happens.
Oh, wow. Wow, never even considered that. And then all the while, we're talking about their life. So this is,
Yes.
the ramifications are quite serious. This isn't a diet or a self-help book. I mean, this is, this is their life, and it's an affliction that they didn't ask for. So there's all those issues as well.
Very much so. Very much so. And just as in any other situation that we don't ask for in life, there's
Mhm.
some common issues there too. People often start off asking why me, why this happened.
Mm.
And in the case of cancer in particular, that's a very disempowering question. That's not helpful actually, because
Right.
we don't usually know why. It's rare that we know why somebody got cancer. Even very healthy people who appeared very
Mm.
healthy and had great
Mhm.
lifestyles get cancer. There's nothing fair about it. So asking why isn't actually helpful. Um, and it also demonstrates that the person is in some way still in resistance to the experience. As if they're saying, "Well, this shouldn't have happened to me. I can't figure this out." It's not a great place for them to be putting their energy. The more helpful place for them to funnel their energy is, okay, this is what happened. Here I am. And now what? What do I do now? And my work then is helping them learn to make choices along that path that are beneficial and result in whatever it is they want, the life that they're looking for.
Yeah, it's so many thoughts. I think about people like I lost a lot of weight, for example, and
Yes, you
people
did.
go
Amazing.
through a traumatic weight loss, and then once it's over, I don't know the number, but it's very high. They gain it right back, so they
Mhm,
could go back to their old behaviors. I
mhm.
just wonder if that happens here. I mean, no, but it's really not that applicable because it's not like their life they were destructible in their life to earn the cancer. They got it from, again, we say we don't know how or don't know why. But it is there anything similar to getting cancer for somebody? Is there any parallel you can draw? I can't think of one.
No, I think it's somewhat different to the situation of the weight loss, which is incredible, by the way. I mean,
Mm,
there was some weight loss.
uh,
Um, eh, yeah, because there's a lot we can control with respect to whether we gain weight or lose weight.
right.
There's a lot that's controllable, and it's a question if we choose to manage it. Whereas in cancer, we said just before, it often isn't fair. It really isn't predictable in most cases. Now, there are things we're learning more and more about what a person can do to keep
Mm,
themselves healthy, not just against cancer, but against all chronic disease.
mm,
So I'm a great believer that yes, nutrition does make a difference. There's documentation. There's huge research actually.
mm,
Exercise makes a difference.
mm.
So there are things which are well supported more and more so by research now. The warmth of a person's relationships, the sense that they have of belonging and being connected to other people makes a huge difference, not only in their quality of life, but also even in their survival.
Hmm.
So these things are very significant, and yes, so we take advantage of whatever we can affect and have some influence over. But it's not a perfect game, of course. It's just not a perfect game.
And where are we in with cancer research and it's certainly better than it's ever been. But
Mhm.
where are we with cancer?
Well, what we do know is that there there actually hasn't necessarily been a lot of difference in ultimate survival, but what we do know is that treatments are allowing people to live longer and longer and longer,
Hmm.
um, sometimes with cancer, or sometimes they'll have, cancer a few times, but remission in between. So people can live longer and longer and longer having had cancer, even if the cancer returns in many cases. They'll get through it again and then live, a longer, another interval. So the lifespan is increasing. And of course, the beauty of that is that a person gets these other opportunities, whether or not they ultimately succumb to cancer at some point in the future, they get these other opportunities to live life the way they want to in that longer interval. That's a beautiful thing.
It certainly is. And do we? Will there be a cure in our lifetime?
Oh, I'm not the expert on that, but there's we don't know. We just don't know. I mean, there's still way too many unknowns to be able to determine that. There are certain cancers that are quite curable at this point. Fortunately, for example, Hodgkin's lymphoma, that's a very, but I think it's about 97% curable. So very
Wow.
curable compared to what that used to be. Breast cancer, if it's caught very early, is
Hmm.
usually very successfully treated, very successfully treated. And then the question is, how much do we have between that and any further rounds that might happen? Some people never see it again, or it might be a very long interval. So that's quite a good prognosis too. And then there's the ones like we mentioned, pancreatic cancer, which still, given the late diagnosis, the chances are not much better than they used to be.
And we still don't know if it's hereditary, if it's diet, if it's environment.
Chances are it's a combination of all the above. A lot
Mm.
of progress has been made in identifying gene activity with respect to cancer, but we haven't necessarily been able to cure what happens because of that. But actually, um, you know, th- for example, in breast cancer, one of the most common cancers, I believe the figure is something like only about 10% of it is actually genetically determined. So
Mm.
clearly, there's many other factors that affect it, some of which are being identified, some of which do have to do with lifestyle, and they're being identified.
Absolutely incredible. And the way we need to, I mean, certainly women need to get mammograms, men need to get, I'm over 50, so I have to go
Mhm,
every 2 years and get,
mhm.
colonoscopy. But other than this, do we, at a certain age, do we, with certain hereditary, um, findings, do we need to look for it more? Because we want to catch it at that early stage. Early detection is everything.
It is, and again, diagnostic tools have improved over time, which is
Mm.
helpful. Um, but in my mind, the very best thing an individual can do, and I imagine you're on this wavelength too, because of the fact, what you learned through this weight loss journey, is
Mm.
simply learn to pay attention to your body.
Mm.
Really pay attention to what it has to say and don't overlook its messages. So, for example, I met a man one time who was in the late stages of esophageal cancer. And again, in its late stages, that's another one that's not very curable, and the
Mm.
treatment is very harsh. Um, and for the longest time, he said, I had no idea this was coming. I went in one day and they diagnosed this and no idea. But in retrospect, he then said, actually, I noticed that I was really fatigued. I was getting tireder for about a year before this was diagnosed.
Wow.
And it's the kind of thing that we don't at all think, oh, this could be cancer. And nor should we. I mean, there's a lot of reasons
Right.
for being fatigued that aren't cancer. But the point of the story is that if we're noticing an increasing and relentless fatigue, we should look into it. Our body's trying to tell us something. And hopefully it's not cancer. Again, it could be many other things, but whatever it is, we should pay attention to that and look into it and not let it go by the wayside because we're pushing through. That's an American paradigm that we need to perhaps get
Mm.
over ourselves a little bit. Our bodies are really wise. And if we listen to them, we'll all be better off.
Hmm. That's sound. That's sound advice, doctor. And if we're friends of somebody who is a cancer survivor, how do we support them the best?
Good question. Beautiful question. There's a lot of possible answers to that question, but I'll just, you know, give an intro to the wide range of possibilities here. The very best thing to gift somebody with cancer is your presence.
Mm.
Is your presence. Just being there with them, acknowledging whatever they tell you they're going through with empathy. Gee, that must be hard for you.
Mm.
Sorry to hear you're feeling crappy today. As opposed to a very significant tendency that's out there to try to override it with positivity.
Mm.
Which isn't to say, positivity has its role. We all want to hold the vision that this person's going to recover, including the patient themselves. That's a good thing. But if the patient is saying, I'm having a hard day, not to say, oh, you'll get over it. Oh, you're done with treatment. You must be done. How could you be feeling bad? Um, it's more to say, I'm here. How can I help? What do you need the most right now?
Mm.
Just meeting them where they're at is an incredible gift. And just hear what they say, whatever it is. Sometimes it's just to sit there with them. Sometimes it's to talk. Sometimes it's not to talk. Not to have to struggle. Nobody has to struggle for words around a person with cancer. Just inquire how they're doing and be sympathetic to that. And then just listen. Just listen.
And I think that would hold true not only to friends, but to family, to anyone that has a close one that's a survivor.
Absolutely. As family members, we can get really invested in this.
Mm.
I saw this as my father was going through. Everybody wants to do something. And of course, the motivation is caring and beautiful. They're coming from a very caring place. I want to appreciate that. And sometimes the effort to help is off the mark, not what the person wants or needs, in which case it becomes a bit of a burden to them. And that's not helpful. They won't look for more of that. Let's put it that way.
I remember this is going back a little bit. There was a gentleman who had pancreatic cancer. I want to say
Oh, yes.
Randy Posh.
Yes, Randy Pausch. Yes, I know exactly who you're talking about.
Yeah, and he wrote a great book, and he went on tour, and he
Hmm.
had a slide presentation, and
Yes.
I think we were all introduced to him by Oprah. So this is going back a
Hmm.
while,
Yeah.
and I'm getting chills thinking about it, but I mean, just the things that he was saying, just his life lessons,
Hmm.
and I remember I have daughters. He had daughters, or had his daughters are still around. But I remember like giving advice, like when interacting with people, don't just watch or listen to what they say, watch what they do.
Hmm.
And just these kind of real like. Uh, life altering pieces of advice and what he gave and his point was, and I've heard it before, that cancer is a great gift because he had the ability to say goodbye, and he had the ability to share all these pieces of wisdom that he had to help others if so needed. Can cancer be a gift?
That question often is very prickly to cancer patients. Nobody really wants to
Mm.
think of cancer as a gift, after all. But um, there are gifts that can be derived from the experience, for sure. And Randy Pausch was an amazing example of that. A phenomenal. He had a cancer that he knew
Right.
he pretty much knew he was not going to get out of this one, and yet to have the courage to live as he did, to travel as he did, to share his lessons as he did, to be um, there for his family as he apparently was, an incredibly courageous human being from whom we can all learn lessons. Yes, I was very, very inspired by his book.
Yeah, my sister passed away in an auto accident, right? So
Hmm.
never got a chance to say goodbye. And certainly there's no easy way to do that. But I mean, I remember his particular point was, have been given the chance to tell everybody exactly how I feel and be able to say goodbye. And like you said, though, everybody handles it differently. Some want to talk about it and some don't. But perhaps perhaps that's just the optimist who thinks there's a silver lining in everything.
Yeah, yeah. You know, th- th- what we can see in Randy Pausch is a perfect example. Um, this is a person who came to full acceptance
Mm.
of the situation, which freed his energy essentially to do all these beautiful things that he did. So acceptance is very key here. Um, and this is the crux of my work also, to help a person get to acceptance if they're not there already. And then what do we do with that? But the acceptance is what allows the person peace. They're not putting their energy into anxiety about when is the end. They're putting their energy into, here's the time I have.
Hmm.
Today is, I have today. So how am I going to make today wonderful? And yeah, there is something very beautiful about, I mean, let's face it, none of us gets away from death in whatever way it's going to happen to us. But, I also remember with my father thinking that, okay, this is sad, this is hard, but we've had advance warning. And
Hmm.
so we can make the most of this time that we have here. That in itself is a very, very beautiful gift, even though a very poignant one.
Right. Would it benefit you in helping the survivor to actually be introduced to them before the handoff or during the handoff of surviving the cancer?
Sometimes that does happen. Sometimes a person will find me while they're still going through treatment for various reasons. Some people develop fears during the treatment, not just afterwards. And
Mm.
so I've often supported people in that way. Um, Here's what I would say about that is that so given that fear, for example, even just talking about fear of recurrence alone, that was the one I said before was 70% of survivors. If we know that it's that prevalent, why not take that into account from the beginning?
Hmm.
That this person is very likely to encounter this ongoing fear. So, what can we do right through the process to reassure them, to provide them, once the treatment is finished, to provide them the support that they need to um, work with that emotionally and get themselves back in charge? To me, we should anticipate this. This should be absolutely be part of the process if it's clear that that's likely to happen.
Have you invented this service, this process?
I won't go as well. I have my own way of working with it. I mean, I have my own proprietary way of working with it. That I guess I can say I invented. I'm not claiming that it's the only way, although it's a
Hmm.
very effective way. So what I figured it's part of my mission right now, though, to just make sure that the awareness is out there,
Mm.
particularly among the survivors themselves, who are struggling and may not know why they're struggling because the system hasn't made it clear to them. So I think I'm fairly unique in doing that, or at least I certainly was when I started doing it back in around 2013, 14. More people are talking about this now, and that's a good thing because there's unfortunately way too much cancer out there and an awful lot of people who have been
Mhm.
struggling. So I have a particular way of going about it, but I think I share principles with a lot of people who are talking about this at this point, and it's just important that the work that we do become the not the exception, but the norm.
I see on your website you do speaking engagements. So, when I ask if you invented this service, are all the major hospitals and cancer, providers, cancer uh, institutions, are they offering this service? You say it's becoming more prevalent now. Within the last year, within the last couple of years?
I would say we can see some progress within, let's say, the last 10 years, roughly.
Oh.
And then it's a question of what does the progress look like?
Hmm.
So, hospitals and treatment centers are very often very bound by research. They base everything off of research, and research has its own rather slow pace. It's good that it's there, but it proceeds slowly. And so sometimes post treatment support will look like yoga classes and massage. I'm all for that. I love yoga, I love massage. I think they're very helpful, and also in this setting they're very helpful. And that doesn't begin to touch the universe of issues that a cancer survivor deals with. They're helpful, but it's just we just open the door crack.
Hmm.
So what the process now that's happening is that we're going on from yoga, massage, exercise classes, very important, that sort of thing. Notice that these things mostly deal with the physical body,
Right. The
and they're very
physical.
good for the physical body.
Right.
But the progress into the emotional realm is still very, very much in its infancy, as far as I'm concerned. Again, you'll find social workers, you'll find psychologists in this oncology setting, and I bless them for all the work that they do.
Mm.
But very often the work is more focused on let's get you back to work. Let's find the workplace issues you have. All necessary, all needed. but it's a very practical sort of thing. Still, it's just those emotional and what I would say is the existential issues of this.
Hmm.
These are the ones that are least dealt with and often actually the most troublesome to the survivor because they're the longest lasting to the extent that they're not dealt with.
Wow. When we not often, but occasionally I get introduced to somebody or somebody says, "Oh, so and so, good friend of mine, cancer survivor."
Mhm.
That gets, that label gets put. I would think how some may want that label, but some may not. You mentioned before identity was an issue. Some may not want to be identified as that.
You're right. You're right. You'll find people, for example, saying, I loved my cancer support group. I couldn't do without them. And some
Hmm.
people will say, I don't want to be identified as a cancer survivor. I'm not going to support group.
Hmm.
So again, it's one of these things that there's a spectrum, depends on the person. And either way is fine. The person who doesn't want to be identified as a survivor is demonstrating their motivation to move on from there.
Ah.
That could be a good thing. We can't erase the experience. We don't want to erase any life experience. We want to learn from it and use that wisdom going forward. So, it's got a light side and a shadow side to it either way. But that's fine if that person is motivated by the idea that they are no longer a survivor. They just want to live their life. We can do a lot with that. And the ones who maintain the image of survivor, the identity that they're a survivor, that's okay too. Now, we don't want them to always be in fear of cancer because of that, but we want them if that's enriching their life because they have gathered their courage and faced something incredibly hard and come through the other end and they're appreciating what they've learned from the experience. That's beautiful. That they have developed their internal resources. So either way can be okay in the end, and it just depends on the person.
Hmm. I guess you could say similar to like Alcoholics Anonymous or substance abuse, or they go to the meetings and some they don't mention it or they don't want to be identified as it.
Mhm.
It's a very, very interesting take. As you were talking, I was also wondering, even, the COVID pandemic, we've had some, that have gone through the, deep stages of all the, and then survived it. And of course, some have passed.
Mhm.
Could there be some of this treatment available for somebody like that? Certainly, it's shorter term, but depending on the person's health, it certainly could be fatal. I wonder if that could be extend what you do could be extended to something like that.
This, of course, is very new, and you're asking
Mm,
an interesting question. I would think that the most applicable scenario is people with long, what they call now long COVID, who have
right,
had the acute part of COVID, they have
right.
survived, and their life is quite different as a
Mm.
result.
Can't smell, can't taste. Yeah.
Yeah, as it happens, my daughter's best friend. My daughter is 40. Her best friend had COVID, and this was a very healthy, robust girl. Before that, she ran marathons and all
Wow.
kinds of things. So she was fit and healthy. She got COVID, came through the acute part okay, and not didn't take particularly long for her to get through the acute symptoms. But she has heart arrhythmia now, sometimes difficulty breathing. So things that were obviously not an issue for her before
Hmm.
for a relatively young person, now she's living with that. This is difficult. This affects life, and it's difficult. And so, people in that situation who in a chronic COVID situation, imagine in some cases this is their life does not look like it did before, and they're needing to learn how to manage, not just manage, but even thrive under what they've got to deal with.
Right. Absolutely fascinating. So, how does discipline play a role in what you do,
Oh,
doctor?
yes, it's a great question, and I know that's the theme of your podcast. It's a beautiful thing to talk about.
Thank you.
Discipline. What I think of when I think of discipline is will and commitment. In my
Hmm.
own life, it's been my experience that if I'm committed enough to something, then I will find a way for it to happen. And sure enough, I will even gather to myself, not even necessarily by my own efforts, things will be attracted to me that I will need in order to fulfill my commitment. Some of it will be my own efforts, and some of it will be just sort of magnetized. So, commitment plays a huge role here. And so ultimately, the discipline, in my mind, is about how committed am I? Am I disciplined in terms of my commitment? because then everything else becomes simply what I need to do to get from here to where I want to be. And it all falls into place if I maintain that commitment. And maintaining a commitment like that requires a lot of discipline.
Right.
It's very easy to fall off of that, isn't it?
Hmm. And you can share this with, by the way, are they patients? Are they
Now I call them
clients?
clients because I'm
Clients.
working in sort of in a non-medical setting. I'm working more in a
Mm.
counseling, coaching type setting.
And you kind of have to, uh, well, obviously they have to maintain some sense of discipline as well, especially surviving the ordeal.
Yes, there has to be something within them that is
Mm.
persistent and resilient and keeps showing up.
Wow.
We have all probably heard stories, hopefully not, people too close to us, but we've all heard stories that somebody was diagnosed and they didn't see any other possibility than the diagnosis, though they believed the statistics and they didn't do very well. In fact,
Hmm.
they succumbed to the disease. So part of the journey is people have to be willing to believe in the upside possibilities for themselves. Um, it is almost never, by the way, helpful to recite statistics, survival statistics to a cancer patient.
Mm.
Almost never. I mean, yes, these things are useful in research and for developing treatments and that sort of thing. But in the clinical setting, I have not yet seen a situation where this was helpful.
Wow.
Because what people need to hold on to is things could go my way, or let's see what could go my way in the situation. They need to hold on to that. Otherwise, they lose their entire quality of life immediately. There's no point in anything anymore.
Wow.
So even that, being able to, in terms of discipline, able to hold on to the potential upside of the picture, that requires discipline.
It certainly does.
Yeah, holding on to one's vision, whatever that may be, requires discipline. And in this case, it's that I can live beautifully a whole life from here on out, even though I've had this disease.
Yeah, it's fascinating how I get decent amount of pushback when I mention discipline. I perhaps some think I'm implying that all you need is discipline. But you
No.
mentioned commitment, you mentioned will. I just all those things deserve, require an element of discipline, like
For
you
sure.
said. And and your book, The Cancer Survivor's First Aid Kit,
Mhm.
where you put pen to paper, what was that process like?
Um, well, it's a the book is short, but it comes with a CD and a workbook and a quick guide. It's a little bit of a multimedia kit.
Good.
So it actually came together pretty quickly because when I chose to put it out there, I'd already been using this method clinically, and so I just
Mm,
want because it was sort of self-contained, I decided I'd put it into a little kit and make it available to people
that's great.
who, may or may not have the desire to do longer-term coaching type work, or perhaps can't afford it, but they can get something out of this tool itself. So it was a kind of a fun process to put it together for me, and it's satisfying once you put something out in the world, knowing that people you may never meet may be using it and perhaps getting something out of it. That's a nice feeling.
Yeah, and you do a really good job by the way, on your site and your content. So how do you measure success, doctor?
Are we talking about success for my clients?
Yeah.
Okay, the success is that they have that I've seen signs that they're taking back this personal power that I mentioned earlier.
Hmm.
Because once we are aware of and making choices from a place of empowerment, then we can create, and again, we can't control everything in life, but the choices that we do get to make, we're making such that we create results that are fulfilling for ourselves. So that's what I'm always looking for people who are fearful and scattered and overwhelmed. Again, no blame, no shame about that. It's actually a normal and natural consequence of what they've been through.
Hmm.
And it can be transformed. So I'm looking for that transformation the day they say, "Yeah, yeah, I get it. I here's what I'd like to do about that," as opposed to looking for yet another hand to hold. Not that we don't need support all our lives, but not we shouldn't be looking to support for the choice. We should be. making the choice and then say, okay, now I need support walking forward into this choice. So when they take back their power of choice and they're actually living from that, that is a very significant success.
Wow. That must be very rewarding when you sense that.
It is. And, there are people who say to me, oh my goodness, you work with cancer patients and survivors. Isn't that depressing? And
Mm.
I say, not a day is depressing. Never, never. Is it challenging? Yes, of course. But it's actually inspiring to me because I get to see people doing this.
It is inspiring, doctor. And how do you personally measure success?
Success to me is living living life on my own terms.
Mm.
And I've done a lot of work on what those terms are.
Right.
So that's not just a statement there. I've done a lot of
Right.
work on my own values and how I want to be showing up in the world
Mm.
and the results I want to create. So when I recognize that I'm making choices according to that vision and according to who I want to be, then I'm in integrity with myself and that's success.
Hmm. Yeah, that's very inspiring. Well, Dr. Shani Fox, thank you so much for your time today. My goodness, very inspiring. Um, please tell us. I've been to your site, but tell everybody how can we, if we know somebody or are a cancer survivor ourselves, how can we get in touch with you?
Probably the best is to go to my website, which is drshanifox.com. That's drshanifox.com. There are resources there. There's a portal to buy my book if you choose that. There's a Facebook group for women who have come through cancer, a private Facebook group, if that applies to anybody. And there's just very simply a way to contact me. There's a contact page. Just email me, let me know what you're working with, and I always answer every inquiry personally.
Thank you so much for your time today. I mean, it's really inspiring. It's cancer is just one of those subjects where, with all the what's going on with COVID and everything, some of these really big medical priorities kind of get shifted a bit, and they get sent back, and it's terrible. But everybody's been touched by cancer, as you've mentioned, and your service just seems so required and obligatory and mandatory.
Well, hopefully it will be seen that way, not because it's my service, but because there's a need. And I would wish that every cancer survivor can find the support that they need. And what I would want them to know is support is out there. Whatever you do
Mm.
need, support is out there for you. And so get in touch with me or anybody that you feel would be your best support, but don't hesitate to ask.
Doctor, thank you so much for your time today. Really appreciate it. And I look forward maybe one day to meeting you and having a cup of coffee and discussing even further. Thank you so much for your time.
It's a great joy to be here.
Be well. Bye now.
Bye bye.
Thank you for listening and or viewing Joey Pinz Discipline Conversations. Please share this episode with one or two of your friends who you think may benefit from the episode. Our website, www.joeypins.com. There you'll find lots of resources and you could join our mailing list. Please follow us on all our social media, Instagram, Twitter, and Facebook. Podcast information, the video version of our podcast is on YouTube. Please subscribe. Audio is on all major podcasting platforms. Please follow them. And if you like it, please consider giving 5-star rating. Would really appreciate that. Would you like to financially support the podcast? You can go to our Patreon site. Consider $5, $10, or $20 a month. There's all kind of plans that we have there. There's like a one-time payment. What is this podcast episode worth to you? $25, $50, $100, $500, $1,000, $5,000. You be the judge. You can go to our PayPal account to do that as well. Thank you again for listening or watching Joey Pin's Discipline Conversations.